All right. Thanks, everybody, for joining. We're going to get started. Thank you, everybody. My name's Nick with NurseRegistry, and today we're just going to go over how our agency works. We are a per diem nursing agency to where you can pick up shifts on the side and have supplemental income while you guys get your career started. I'm the talent manager here at NurseRegistry. I deal with all of the recruitment side as well as compliance and making sure you guys have all the tools and necessities to start taking on these per diem assignments. As well as Eric, he's our client liaison. So he deals with a lot of our private duty side of things as far as the client side goes, as well as he deals directly with the nurses pairing for these private duty jobs. First off, I did just want to congratulate everybody on your upcoming graduation. All of your hard work and dedication really does pay off, and I know that a lot of you are just excited to get started. So really, what happens next? You've graduated and you're ready to get started in your new career. Hospitals. That's really the first thing that comes to mind when it comes to nursing. Many people automatically think hospitals are the main job and the only setting that nurses work. But we know that more than half of nurses actually end up in full-time hospital placements. However, there's a lot of opportunities beyond the hospital. We found that over 60% of nurses do end up working in a hospital setting, but that leaves a large portion of the nursing career open to other job settings. About 40% of jobs for nurses are outside of that hospital setting. With NurseRegistry, you're able to really embrace a wide variety of job placements from private duty, rehab facilities, skilled nursing, and schools. On the private duty side of things, it's really a lot of one-on-one care, doing personalized healthcare in the home on a one-on-one basis. For skilled nursing facilities, you do get a lot of professional networking and variety in the different locations that you're able to work with. For rehab and education, we found that nurses do get a specialized experience. You really get a sense of that niche experience that you gain from working in those settings, as well as seeing a diverse, wide variety of patients. For home health agencies, there's a lot of professional growth opportunities. Working with a home health agency, you'll be able to work with a team, as well as start gaining that private duty experience so you can begin working on your own on a one-on-one basis with private duty. And then schools, we do work with a number of schools in the area, and you'll be able to have that professional development working with children, gain pediatrics experience, as well as working with the special education department, or even the schools working on a one-on-one basis with that. So who is NurseRegistry? So we're a staffing agency that's been working since 2009, and we really offer job placements for nurses looking for supplemental work, as well as gaining experience in different career settings. We work with a lot of private duty, home health, and healthcare facilities throughout California and Florida. We have over a decade offering nurses that scheduling flexibility, swift placements, 24-hour support for our nurses, as well as a variety set of jobs. The type of work that you can see from NurseRegistry, same with on the hospital side of things, ours is a little bit flipped. So a little bit under 50% of our work is private duty in the home on a one-on-one basis. But we also have a pretty big selection of different facilities and different locations that you're able to work at. Like the previous slides, we work with a lot of skilled nursing facilities, drug and alcohol rehab, adult daycare, and home health. So really, with a registry, you're able to kickstart your career immediately. After you sign up, you're able to immediately start looking at job opportunities after your graduation. The big side of things as well is you're able to gain experience in a wide variety of different job types. I know that a lot of you will already have placements in the hospital setting, But while you're waiting for your assignment to start, you can actually start taking assignments at eating disorder treatment centers or drug and alcohol facilities. The other big benefit that we see is you are able to start generating side income. So even though if you're working full time, a lot of the schedules are going to be 10 to 12-hour shifts. So those couple of days off, you are able to work on the side and take a shift here and there. So let me actually pass it over to Eric. He's going to share his story of how he got started.
All right. Thank you, Nick. Well, first of all, I just also wanted to say congratulations to you students who are getting your graduation. I got my nursing license in 2008, so it was a little while ago, but not so long enough ago that I can't remember the jitters of getting ready to take the NCLEX and some of the doubts and uncertainties you have. But we're confident you're going to put your training that you've been getting over these last years to good use, and you'll do well. You know, when I think about nursing and the flexibility that you have in this career, it reminds me of an experience when I was just starting my education. I was in a CNA class, and the nurse that was teaching the course told an experience of a student that was interested in nursing, but she told her, I'm interested in nursing, but I'm also interested in aeronautics, and I've actually always wanted to work for NASA. And so the next day, the nursing instructor found an article that she brought into the student about NASA nurses. And it's true. In 1960, you can look it up, Dee O'Hara became the first nurse to pilot a new field of nursing called nursing aeronautics or aerospace nursing. So the point is the field is wide open to you. You have so many options of how you're going to practice your nursing, how far you want to go as far as education within the field of nursing. And so we're excited to talk to you about how NurseRegistry can fit in helping you as you expand your horizons and progress as a nurse and look forward to those things. A little bit about my background. Like I mentioned, I graduated in 2008, and then I worked primarily in critical care at some various ICUs and emergency departments. And then a few years into it, I took a per diem job. It was at the hospital, but it was per diem, and it was in the critical care float pool. So they would float me to one of 3 different ICUs and step-down unit, some telemetry units, and the emergency department. But what I liked about that job was that it was per diem, and it really gave me a lot of flexibility in my schedule, which is what I like about how NurseRegistry works for the nurses' schedules as they work with them. I had some other opportunities to do some travel nursing, which I really enjoyed, getting to work in different places, a couple teaching hospitals, Penn State Health, Milton S. Hershey, and Stanford, and then a little bit of nursing leadership experience as far as a charge nurse, house supervisor, some things like that. But the great thing about per diem nursing, as we've talked about, is creating your own schedule. As you can see, you can take control of your schedule, decide when and how much you work, and let your career really fit your lifestyle. So there's a wide range of opportunities. Nick mentioned it. You saw it on the pie graph. SNFs, skilled nursing facilities, some eating disorder clinics we work with, surgical centers, sometimes reconstructive and plastics, recovery areas, or working intraoperatively there, and then private duty. And some of our nurses really love private duty. And one of the reasons is you really have the time to spend one-on-one with your patient. For a lot of nurses, it's the kind of nursing they were hoping to practice. As you've done your clinicals, you probably added more and more patients to help you learn how to juggle caring for multiple patients. Maybe you're taking care of 4 patients, 5 patients, maybe more. Nurses working at a SNF certainly are taking care of more patients with the help of some ancillary staff. But that opportunity to work one-on-one lets you really get close to the patient. You end up knowing their medical history inside and out, knowing how to assess them very clearly as far as how they present when they're in pain or discomfort, things like that. Interacting with the family. In fact, really our nurses in a lot of times kind of become part of a family. They get invited on family vacations as the nurse at times to work with the client, and they get really close with them. It's interesting at NurseRegistry, we work with a wide variety of people, but some individuals we work with are household names. Of course, we have non-disclosure agreements and HIPAA that would prevent us from elaborating. But the point is, this opportunity to tailor your schedule to work how you want to work, the opportunities that might come up to work with some very interesting, fascinating people in some very interesting places are all just some of the benefits that come with working for NurseRegistry. And based in Silicon Valley, NurseRegistry utilizes technology and really leverages it to help the communication between NurseRegistry and the nurses and even the clients. So a streamlined process is what you can expect as a nurse if you're working for NurseRegistry. We keep things very simple. In fact, I kind of compare it to this. If any of you maybe during your time in schooling did any gig work like Grubhub or DoorDash or Instacart or anything like that to make a little extra money, it has a similar feel in the sense that you have an app. You get alerts on that app when we have a job that is within the area, close enough to your proximity, and it fits the skill level and the abilities that we know you have. So these tailor-made jobs get pushed out to you. If you want to take the shift, you accept it and you go, and then you get paid. It's really that simple. And the nice thing is when you're a nurse, and especially when you're starting out, I remember the fear of being in over my head. And that's what you don't want to do. You don't want to do something to put your license at risk where you're in over your head. And one thing that NurseRegistry really excels at is personalized support. You really work with a small, dedicated team at NurseRegistry. We are on a first-name basis with our nurses. They don't call like a massive call center, but we know them. We know their situation, their skill levels. What we do is we build a profile. So when you start out, you let us know what skills you're comfortable with, what experience you have, what shifts you like to work, whether you work day shift or knock shift, or if you're open to either. And we build this profile so that when we have jobs, we know how to match up the nurses with the right job. And of course, anytime you had any concerns or needed some support, NurseRegistry is going to be there for you. They have your back. And I can honestly say that from Nick, our talent manager, to myself, to our schedulers, all the way up to our CEO. We have a tight team that is interested in your success and how we can work together. So that personalized support is very, very critical. NurseRegistry is a nurse-forward company, and nurses love working with NurseRegistry. As you can see on the screen here, some testimonies from just a couple of our nurses. They highlight the flexibility, being able to choose patients closely matched with my skill set. And this other one mentioning it's one of their favorite companies they worked for, and that's not isolated. We hear comments like that all the time. In fact, very often, nurses that work with NurseRegistry, they refer other nurses because they like the opportunities so much. And the nice thing about that is we even have some incentives built in. If you refer a nurse, a colleague, and then they sign on with NurseRegistry and they do 3 jobs, there's an incentive program for you in that as well. When I think about some of the nurses loving the flexibility, it's neat to get to know some of them and what they've been able to do. A couple I can think of, sometimes they have family responsibilities where they need to provide care for a family member, but NurseRegistry is a perfect fit for them because when they are available, they can look for jobs, sign up, and go do a shift here or there. And I knew another nurse that loved to cook, was interested in restaurants, and so she actually operated a restaurant while working on the side as a nurse for NurseRegistry. Other nurses that we've worked with have doctorates now of nursing practice and work as a psychologists, nurse practitioners, various things. And they did that while they were going to school because NurseRegistry was so flexible. It allowed them that opportunity. So that's just a little bit of an overview of that. I'm going to turn it back over to Nick, and he's going to talk a little bit about how to join NurseRegistry.
Thanks, Eric. Really, for the application process, it's very streamlined. As far as joining, it's a few simple steps: applying online, interviewing with one of our recruiters, sending all of the credentialing items, and then join and get started. And it's as simple as that. That concludes our presentation side of things. I wanted to open up to everybody if you have any questions for us.
Hi there. I had a question. So it was interesting seeing all of the job types that you guys offer. But of course, as you know, I'm graduating soon. I don't have a lot of experience. So I'm wondering, of those job types, where would I be able to work as a new grad, and do any of them offer training?
Yeah, that's a good question. And we get asked this from time to time. Sometimes people ask if we have an integrated practicum or residency type of nurse residency situation. And we don't, as a private duty nursing company, we don't have that, but we do have a few recommendations, as you mentioned. Number one is don't hold back from getting training. If you have the opportunity to work at a hospital that has a nurse residency program or has some kind of training, that's just going to help you. And as Nick mentioned, you can work on the side at Nurse Registry. Many times you're working 312, so you've got some extra time. So look for opportunities to build up your skills. The other thing I would say is our facility work is geared towards that, in the sense that they will provide their own training programs to catch you up, some orientation, and sometimes a little bit of an extended orientation. So that can be very helpful in that regard. And then the third thing I would say to keep in mind as far as the comfort level is, you'll be surprised how comfortable you get with most of the types of patients that we have. And what I mean by that is this: these are not, for the most part, critically, acutely ill patients that need to be in a hospital, or else they would be in a hospital. So when they're at home, they're doing well enough to be at home, but they need some additional support. So you're not worrying about juggling multiple patients. You're not worrying oftentimes about incredibly high level of acuity, but just people that need the support of a nurse that can think like a nurse, that can develop care plans to move them forward in their healthcare goals, provide assistance in transporting and ambulation so that they don't fall if they're a fall risk, giving medications and things like that. So you'll feel like you can quickly get up to speed, but also, as I mentioned, open communication. We'll know what your skill level is and be able to send jobs to you that really fit your skill needs so that you can grow with Nurse Registry as your skills develop.
Awesome. Thank you for that question. Was there any other ones?
Yes, I have a question. Nick or Eric, I know Nurse Registry is in California and also Florida. I am currently graduating in the Southern California area. Like as a new grad, what type of hourly rates should I expect? How much can I earn in working?
Yes, that's a great question. So with Nurse Registry, we are a per diem agency. And with that, all of the nurses that work with us are actually independent contractors, which does give you the ability to set your own rate. And I know that being a new grad, you don't have much experience or visibility to what the rates are out there. But on average, I would say the nurses that work with us for RNs, they're seeing anywhere from $50 to $60 per hour. And then on the LVN side, it's anywhere from $30 to $40 an hour. Now, the rate that you set really depends on the specific location, the work setting for the job assignment, as well as your baseline experience. Now, when you're joining with us, when you speak with a recruiter, we will able to help you guide you to kind of a more concrete number, but ultimately you do get to set your own rate. And those are probably the average. So 50 to 60 for an RN, and then 30 to 40 for an LVN.
Thank you so much.
Hey guys, just a quick question here, and sorry if you already covered this in the presentation, I missed it. Is there a cost or a fee to join the registry, or like to have an active account with you guys?
Good question. No. So with our agency, there isn't any upfront costs. We run background checks and get everything set up for you utilizing our staffing app. So no cost to you, as well as the other benefit is there is no minimums. So a lot of nurses, you guys are looking for possibly for full-time work. So you may not be able to take assignments on a regular basis. So with the flexibility that we offer, you're able to work the shifts that you're interested in. So there's no upfront costs, no cost to maintain an active account with us, as well as we don't have any minimums that you need to work.
I had another question. So how many jobs or job offers should we expect to get on average, like each month?
Yeah, that is a very good question, and that can vary quite a bit, as you can expect with different needs that have come up. But I'll tell you this to, I guess, put in perspective. A lot of it has to do like in the private duty world, especially. It's not like working for a hospital where you're going to get your shifts no matter what. But what we do see is that when nurses really work on their bedside manner, they're good at communicating with the families. People want them. They get requested a lot. They get that reputation, and they end up working a lot. We have nurses that nurse registry is their only job. They're working full time for nurse registry. We have other nurses that are working, a job a month or every couple of weeks or whatever. As Nick mentioned, there's no minimum, but there's a broad range. So I would say some of the main things are bedside manner, be a good communicator with families. Understanding family dynamics will help them appreciate you even when families are wrong about something, knowing how to present that to them so that they're not offended and so they understand that you have the best interests at heart is important. And also dependability. When you can be dependable for the shifts you sign up for, both nurse registry and clients notice that, and there will be more opportunities for jobs. So it can vary anywhere from a few offers to full-time work. And the other thing that will be important is keeping your skills up to date. As you acquire new skills, updating us on the things you can do so that jobs that require those skills will be offered to you as well.
I might have missed this, but again, how do we get paid and how often?
Yes, that is the question of the day. So to get paid, it's very simple. You're able to set up a direct deposit, or we can mail you a check. And nurses are paid on a weekly basis. So everything that's worked the previous week will get paid out the next Friday. So everything is on a weekly basis.
That's great. Thank you so much.
Yep. Awesome. Was there any other questions? Perfect. All right. Well, thank you everybody for joining. We will be sending a copy of this video so you guys can review it at a later time, as well as our contact information. So if you have any other questions, feel free to reach out, but we appreciate everybody joining.